when we say sound healing frequencies, so the frequencies do the same thing as what they do in the medicine world. So when the obviously we have to we have to find out the origin of that particular problem. According to that, we have to, if we know as a music therapist and as a sound healer, or let's say sound therapist, we should know a particular frequency on which we have to work with a patient. So music therapy is it has been evolved a lot in these years, in the upcoming years. Obviously, in hospitals also it has been grown. And through more and more promotions and awareness programs, music therapy has been come into the medicine world as well. So, how music therapy is working in the medicine field? Because it is right now we see that music therapy helps in the Alzheimer and mental stress, bipolar, different kind of personality disorders, schizophrenia. So, it has emerged in the medicine field, although not all the hospitals are adopting it, but still there are many doctors in India and abroad who trust that music is involved in medicine as well. Now, how do we say that? Like, for example, if we take schizophrenia, so there are medicines for that, but when we say sound healing frequencies, so the frequencies do the same thing as what they do in the medicine world. So when the obviously we have to we have to find out the origin of that particular problem. According to that, we have to, if we know as a music therapist and as a sound healer, or let's say sound therapist, we should know a particular frequency on which we have to work with a patient. If we know that particular frequency, yes, it has emerged in the medicine world, because frequency is doing the same thing like we do in when you have a medicine or when you have a sedative. So the same thing is done by the frequencies also. That's why we say there are two kinds of music. Now, one music is you feel very pleasant, you are actually emoting, you are having emotions. But in the global music therapy, we have certain sounds which are not pleasant at all, but you have to listen. So it's the same difference that you are treating yourself through medicine. You don't eat, you don't have it for taste, you have to have it. That's why you are having. And when you heal yourself through diet and nutrition, so means that you are getting some tasty foods and you are healing yourself. But when you are having medicines or the antibiotics, you don't have any taste, but you have to have it. It's the same difference between the digital music and the emotional or the pleasant music. So that is more. So when we use digital music, it affects a lot, and you can just say that yes, it works in a medicinal field through the certain frequencies, but then they are not pleasant, they are little metallic or mechanical music. But when we say that music through the pleasant tunes, so that particular music is taking time, little bit, maybe 2 3 weeks more, but they are pleasant, they are a little more natural way. But the other kind of music, digitalized music, may not take time. It just reaches your frequency, it's not taking time, it's very easy approach, but then that's boring. So there are two different approaches of music therapy, and this is how we say that music goes to the medicinal field. Because you have to know the particular sound frequencies, and you have to know that what kind of disease is there. Because obviously when we talk about very chronic diseases, So right now we don't have much researches for that, like let's say hepatitis or AIDS or cancer. Cancer we do have researches, but not that much. But when we talk about the mental illnesses like schizophrenia and insomnia, so when a disease is on its very first stage and it's in a beginner form, then it becomes very easy for the therapist to treat it. And with time, when you're taking the medicine, then it becomes a little then you can't research it up whether the effect is happening through music therapy or the medicine, because for example, the depression patients, they don't want to leave their medicine, because then again that lack of medicines may make them reach to the stage of depression, so they don't want to. But when we ask them with time, so they kind of minimize the dose, and with time we have seen the patients who are not taking the medicine but they still are feeling good. So that's the natural way. And when we say that, when they say the ma'am, it's not happening much, so they use the digitalized music. I mean, we as a therapist, we use digital music, so it gives the same effect that they feel very good. It's very well researched in the in global music that we have. They have geometrical music, they have brain waves music, they have theta music, beta music, binaural, but these are all, you can say, just sounds grrr. It's just really, it doesn't release any kind of emotional dopamine, because but it's giving you satisfaction that yes, it's healing. So it's kind of activating your gray matter. But the thing is that music is not science, it's more perception, it's more perceptive. If you are open towards these perceptive music as an emotion, so that is a natural way. Now, depends upon some your preference, whether you need an easy and fast therapy or the treatment, or you want to enjoy the treatment or your your journey towards well-being. That's the difference.